Hello, I'm Professor Shane Dark of the National Drug and Alcohol Research Centre at the University of New South Wales. Welcome to our series of lectures on drugs on the body. Today we're going to be looking at cannabis. Cannabis is, of course, one of the most widely used drugs in the world, so it's important for us to understand its effects on the body. Before we look at that, let's start by just examining what cannabis is and indeed isn't. If materials, of course, derived from the cannabis sativa plant, all of them have in common that they're agonists for the cannabinoid receptors in the human body, CB1 and CB2 receptors. And THC is the chemical that is responsible for most of the psychoactive effects. There's a whole range of chemicals in cannabis products, but it's THC which causes the sought-after effects. The major forms are, of course, marijuana, weed, it's leaves and heads of the cannabis sativa plant. These are typically sold with predominantly these days is predominantly heads, which are more potent forms of the plant. If we were doing this lecture in the later part of the 20th century, 70s, for example, I would have said the opposite. There would have been some heads in any deal and have been predominantly leaf. The reverse is the case now. And of course, there's hashish. There's compressed cannabis resin, which can either come as just that, as a compressed block, typically black-brown in colour, or cannabis resin oil, hash oil, typically sold in little plastic containers of various sorts. One thing I want to make quite clear, you would have heard the term synthetic cannabis. What this refers to is what we term the synthetic cannabinoid receptor agonists, or SCRAs, drugs such as Spice or Chronic or the JWH series. The one thing these are not is cannabis. They're not synthetic THC. They have nothing to do with THC. So when we are talking about cannabis, we're talking about the plant products. These are the SCRAs are quite separate, and we'll be covering them in another lecture on novel psychoactive products. All right, now we've established what cannabis is and indeed isn't. Is there any toxicity associated with cannabis? Well, there has never been a documented death from cannabis toxicity. The amount to be consumed to cause any toxic effects resulting in death would be astronomical. This is something that makes the drug stand out quite distinctly from many other drugs, for instance, the opioids, or in fact, the stimulants, in that the harms associated with cannabis actually do not relate to direct toxicity. There are, of course, some acute effects that would be unpleasant in many cases. It can be associated with agitation, acute amnesia, intense anxiety, and confusion. So these are acute effects of the drug, which you could probably loosely say are toxic effects in that they're unpleasant effects. With all drugs and drugs of dependence, there is always risk associated with it, and the type of risk associated with them will vary by drug. For the opioids, such as heroin, the major risk is toxicity. For cannabis, the major risk is traumatic accident. That is, people being intoxicated and getting into situations which they cause themselves injury and possibly fatal injury. Well, let's start looking at the various body systems. Firstly, we'll start with the heart. I should emphasise that cannabis is not cardiotoxic. It is not directly toxic to the muscle that is the heart. It does, however, have some acute effects that are of relevance to this lecture. Firstly, it may increase heart rate. Now, that can be For generally, it peaks in about 15 minutes after the peak plasma concentration. So it's an acute effect. There may be a modest increase in blood pressure and postural hypotension. These are, as I've said, reasonably modest effects and acute effects. There are, however, some things that are a little more concerning. Firstly, cannabis reduces oxygen delivery to the heart while there is actually increased oxygen demand. This is a combination that may be proarrhythmic, that is likely to cause or possibly cause an irregular heartbeat. People may not be aware there is a small but well-documented risk, a 5 times increased risk for a cardiac arrest in the first hour following cannabis administration. Now, I'm not going to give you the impression that these are common effects, because given the amount of cannabis that's used in the world, that is clearly not the case. However, we need to be aware that there actually are documented cases of cardiac arrest in the period immediately following cannabis use. Let's now look at the brain. There are a couple of things here that I think are particularly of note. The main areas that are of concern with cannabis use are cognitive impairment and ischemic stroke, that is a stroke due to a blockage of vessels rather than a bleed. Cognitive impairment. Regular use is actually known to be associated with changes in brain structure. There's a reductions in the hippocampal volume, and the hippocampus is the part of the brain particularly associated with memory. There's also abnormalities been noted in the prefrontal cortex, the cerebellum and the amygdala. So there's evidence that long-term use can cause structural changes to the brain. There is certainly also evidence that long-term use has deleterious effects upon memory and attention. Impairment of memory and attention increases as a function of the frequency of use, the dose, duration, and an earlier onset of use. Earlier onset of any substance is always associated with more harm and a higher risk of dependence. In the case of a drug like cannabis with early onset, and it's also true of alcohol, you're talking about effects upon a developing brain if you're talking about onset in the adolescent period. So there's no question that there are effects upon things such as memory. The jury's out to the extent to which that's reversible. Obviously, that would depend on how long someone's been using, how much they've been using, and the potency of the drug that they've been using. The other factor of concern with the brain and cannabis is stroke. Regular cannabis use is associated with approximately a 3 times increased risk for ischemic stroke. That is, a blockage which causes cessation of blood to parts of the brain, causing cell death. These strokes, and again, don't get me wrong, these are not frequent events, but we are here to talk about what are possible risks. They occur during inhalation of cannabis or very shortly afterwards, so it's very much an acute effect. There's 2 possible mechanisms here. Vasospasm, that is literally spasming of the vessel, or vasoconstriction, that is constriction of the vessel, both of which would reduce blood supply to parts of the brain. I want to get across the point here that while cannabis is not a drug associated with intense toxicity, there are factors about it that affect the body which users and clinicians need to be aware of. Now, of course, we need to talk about the lungs. Given this is a drug that is overwhelmingly smoked, of course it can be used in other forms such as in hash cookies, space cakes, etc. But it is a drug predominantly that is smoked either in joints or bongs, i.e. water pipes, most common. Major harm here is chronic bronchitis. And what we're talking about here, of course, is a route of administration effect. This, of course, is something that I could have said about the smoking of any drug tobacco. It's not about here cannabis per se, but the inhalation of it. If someone was just using cannabis orally, this would not be an issue. Now, and of course, the signs and symptoms of the bronchitis actually ameliorate or actually resolve if cannabis smoking is reduced or ceased. So it's very much a smoking-driven and the frequency of smoking-driven pathology. I think it's important to also emphasise what cannabis smoking is not associated with. There's no evidence that it's associated with chronic obstructive pulmonary disease. I'm thinking of emphysema. There certainly is no evidence that that is the case. And interestingly, if we look at lung cancer, which of course with tobacco smoking is a major unambiguous effect of tobacco smoking, there's no strong association being seen with cannabis use per se, which is very interesting and perhaps surprising. But because we do see an association, increased risk amongst cannabis smokers of cancer, but the association appears to be due to the concomitant tobacco use. Probably most cannabis users mix cannabis with tobacco when they're smoking it, and it appears to be that it's the tobacco that is the factor that is causing this association with lung cancer rather than cannabis itself. One final thing, another way, and this is very recent way in which cannabis can be used is vaping. Vaping is something that's come to prominence, particularly with nicotine, in the past decade or so. But it's also been associated with cannabis use, and particularly in the United States. So what you're vaping in a vaporizer here is THC concentrate. There has been an association between vaping and acute lung injury amongst some cannabis smokers. It's been well documented in the States. Cannabis vapors. This doesn't appear to be due at all to the THC concentrate. What it appeared to be associated with is vitamin E acetate being used as a thickening agent. So it's analogous in some ways to the addition of tobacco to cannabis with lung cancer, that adding this thickening agent to the concentrate has been shown to cause lung injury. Let's now look at some of the other effects. Firstly, the liver. I should say here that cannabis is not hepatotoxic. That is, it's not a drug that causes damage to the liver. However, I think we need to keep in mind, if you're a clinician treating someone with cannabis dependence, that cannabis users have a 3 times elevated risk for alcohol dependence. We see that cannabis use, like everything else, fits within a broad context of polysubstance use, and many cannabis users are regular alcohol users as well. Let's have a look at psychopathology now, mental health, because this is an area that I think there's been a lot of interest in. If we look at affective disorders, particularly anxiety disorders, as I think I mentioned earlier about acute effects, anxiety and panic are symptoms of frequently observed acute effects of cannabis. There's been a lot of interest in psychosis, spectrum disorders and schizophrenia in particular. There is certainly evidence that for those people who are at risk of developing psychosis, cannabis increases the risk for psychotic symptoms, schizophrenia and other psychosis spectrum disorders. A couple of factors associated with it. Firstly, it's associated with an earlier age of onset of use. Again, this goes back to the thing, early onset is always associated with higher levels of dependence and consequently more harm. Heavy daily use is also associated with an increased risk, and high potency cannabis itself. Now, I do not want to give the impression that there's been an epidemic of schizophrenia as a result of increases in use of cannabis. I mean, the association, for example, between cigarette smoking and lung cancer is quite clear. As cigarette smoking increased dramatically over the course of the 20th century, lung cancer tracked it. That's not the case with cannabis, which has increased in use in vast amounts. What we're saying here is that people, for instance, with a family history of psychosis, or indeed with existing psychosis, cannabis is a risk factor for developing psychotic symptoms. There is also some evidence that there's increased risk for suicide and self-harm associated with regular cannabis use. This is particularly evident for daily use and heavy daily use, and it's particularly evident amongst adolescents. Now, do not come away with thinking that all cannabis users are going to have suicidal ideation or attempts, but there is increased risk, and the association with adolescents is a further manifestation of the early onset of any substance dependence is associated with a poorer prognosis or a higher risk of a poorer prognosis. Finally, let's look at a couple of other conditions or effects that are associated with cannabis use. Firstly, and this is probably not widely known, there's a twofold increased risk of testicular cancer. This is interesting because, as I've said earlier, cannabis per se doesn't appear to be associated with increased risk of lung cancer if we take out the effects of tobacco, but it certainly has been shown to be associated with increased risk of testicular cancer. And the risk factors, again, younger age of initiation, longer use career, that is, you've been using for many, many years, and more frequent use. And again, I'm not saying that everyone who uses cannabis is going to get testicular cancer, or at least men. What I'm saying here is that clinicians need to be aware that there is an increased risk. And of course, I think the major risk in terms of fatalities at any rate is traumatic injury, and in particular motor vehicle accidents. There used to be a myth that cannabis use made people drive more cautiously and therefore they were driving better. It's interesting because this seems to be the same sort of myth that was associated with alcohol. It's simply not the case. There is a 2 to 3 times increased risk of a motor vehicle accident after recent cannabis use. Intoxication with any drug is never good for driving. One can be cautious, but an unexpected event occurs. The reactions aren't as good as you would be if you were sober. And the risk directly increases with THC concentrations. That is, the more stoned you are when you're driving, the higher your risk of an accident. The issues we've covered today in relation to cannabis are varied and complex, and they are all directly addressed in our book, The Pocket Guide to Drugs and Health. This is page-at-a-glance information regarding all of the issues that we've discussed today, and it presents information on all of the major drug classes and their effects on the mind and body.